When I trained as a doctor, one of the biggest challenges I faced was the sheer volume of information I had to retain. Endless lists of names of muscles, nerves, which nerves went with which muscles, bones, huge numbers of drugs and their uses, names of infectious diseases, how they present, how to treat them. So I learned to use every trick I could find to help me commit these to memory. I used anatomy colouring books, flashcards, but one of the most useful techniques I used were creating acronyms to remember everything. I did learn that if you could make an acronym slightly silly, it seemed to help remember things. Hello, I'm Dr. David Stokes. I'm a GP in Sussex, and today I want to share an acronym with you that may help keep you safe if you were on certain types of medication and you develop a sickness or diarrhea bug. Like all good acronyms, it helps that it conjures an image in the brain, and the acronym I want to share with you is SADMAN. And I think I would feel pretty sad if I had a vomiting and diarrhea bug. The letters of this particular acronym remind us of medicines that we should stop if people are developing a vomiting or diarrhea illness. Most stomach bugs are unpleasant, but self-limiting. You'll feel dreadful for a couple of days, but if you rest, drink plenty of fluids, and let nature take its course, gradually you should recover. The problem comes when you become dehydrated. When your body becomes dehydrated, your blood pressure can fall, your kidneys receive less blood flow, and medications that are normally very helpful can temporarily become a problem. In some cases, continuing these drugs during a dehydrating illness can increase the risk of kidney injury, dangerously low blood pressure, or other serious complications. And this is where the SADMAN comes in. Now, before I go any further, I want to make something quite clear. These are not bad medications. They are mostly extremely important medicines that, if taken well, can keep you healthy for longer. And specifically, a number of them are specifically used for helping keep kidneys healthy, and people with kidney disease need to look after their kidneys. This isn't about stopping these medications permanently or being frightened of them. It's simply recognizing that when a temporary pause is necessary during a dehydrating illness. If you're ever unsure, please do check with a GP, pharmacist, or diabetes nurse, or the specialist team that look after you medically. So let's go through the acronym. SADMAN. S. S is for SGLT2 inhibitors, medicines like dapagliflozin, empagliflozin, canagliflozin. These are commonly used to treat diabetes, but they're also very important now in the treatment of heart failure and kidney disease. They are excellent drugs, but during a significant illness causing dehydration, they can increase the risk of damage to the kidneys or a dangerous complication called ketoacidosis. This sometimes even happens when blood sugars are not dramatically elevated, as they would be in some of the older things that can cause ketoacidosis. During a vomiting or diarrheal illness, patients are generally advised to pause these and seek advice if they're becoming unwell. A. A is for ACE inhibitors, medicines like ramipril, lisinopril, or enalapril, or many others. They're widely used to reduce blood pressure. They're used to look after the heart in heart disease, and they also are very good at protecting kidneys, which are at risk. Normally very beneficial, but again, if you become dehydrated, they can increase the risk of a kidney injury. And because the kidneys are already under strain from reduced blood flow. D. D are for diuretics. These are what often get called water tablets. They make you pee a little bit more and offload some fluid. These are medicines like furosemide, bumetanide, indapamide, bendraflumethiazide. They help the body remove that excess fluid, but again, during vomiting or diarrhea, they can worsen the dehydration, contribute to blood pressure dropping, and ultimately kidney problems. Metformin. Now, this is a very common and excellent drug for treating type 2 diabetes. In severe dehydration or significant illness, however, it can occasionally contribute to a rare but serious condition called lactic acidosis, particularly if the kidneys are already under stress. The second A, this is for ARBs, angiotensin receptor blockers, medicines like losartan, candesartan, and valsartan. Very similar in principle to the ACE inhibitors, and they carry similar risks during a dehydrating illness. And the final one, the N. These are NSAIDs, non-steroidal anti-inflammatory drugs. These are drugs that are like ibuprofen, naproxen, or diclofenac. things that you might actually reach for if you're in pain. So it's important to avoid those if you're having a diarrhea illness or vomiting. They can affect the blood flow to the kidneys, and combined with dehydration, they can cause a significant increase in the risk of injuring your kidneys. So when should you actually act on this? Because this isn't about stopping your medicines every time you have a mild cold or a single loose stool. Generally, this advice applies when you're becoming dehydrated. If you're having multiple episodes of vomiting or diarrhea, unable to keep fluids down, or simply not managing to eat and drink normally. Once you've recovered and you're eating and drinking normally again, usually around 24 to 48 hours later, these medicines are generally restarted again. But if you're unsure, especially if you're older, frail, or have other kidney disease, heart disease, significant other comorbidities, please get medical advice as to when it's safe to restart. Of course, there are situations where you should seek urgent attention. If, for example, you become confused or very drowsy, if you're producing very little urine and can't keep fluids down at all, if you develop severe weakness or chest pain or breathlessness, if there's blood in your vomit or stools, or if you have diabetes and are becoming increasingly unwell, particularly with high blood sugars or ketones. One final point, SADMAN is a memory aid, not a substitute for personalised medical advice. All patients are different and will have different circumstances, and you may be advised differently depending on your own circumstances and situation. But knowing about this is one of those simple tricks that can certainly help you stay safer during an illness. And I suspect there are many people taking these medications who are unaware of the importance of stopping them in the event of a diarrhea or vomiting illness. So hopefully, if you found this useful, please share it, particularly with any of your friends or relatives who might be on these medications and you think might not know about these important reasons to stop temporarily while suffering from diarrhea or vomiting. If you wanted to know more about SGLT2 inhibitors, I've linked a video here that you could watch to find out more. Thanks very much for watching. Take care.